Merry Christmas, my beloved viewers, and welcome back to the channel of your interest. I know we're in a festive season full of kupiga sherehe, full of people enjoying themselves, and I know among hiyo kunjifurahisha lazima watu watafanya ile kitu. And I think that's why my DM is full of questions. People asking about what are the effects of regular use of emergency contraceptives. In this particular video, I'm giving you everything that you need to know about emergency contraceptives and whether it's true regular use of emergency contraceptives is linked with infertility cases. Let's roll up to this video. Let you learn. Welcome back. Emergency contraceptives are a form of contraception that is ideally used when a person has an unprotected sex and they are not willing to get pregnant. Even before we go far, allow me to say that emergency contraceptives is not a method of a regular contraception. There are different types of emergency contraceptives, and just in case for the ones who doesn't know what we mean by emergency contraceptives are the pills that 98% of you knows, the ones that you call the P2s. In P2s, we have different brands. We have the Postino 2, the one that comes with the green packet that people refer to as the original. We have also some other brands like the EC2s and the rest. So those are the ones that we term to as the emergency contraceptive. The reason why we term them as emergency contraceptive is because they are not there to be used as family planning methods, but they are used to prevent pregnancies in incidences where you had an unprotected sex and you are not ready for a child. Ideally, during the introduction of these emergency contraceptives, the one who introduced them because of some few reasons. Number one, introduce them in case someone has been raped and they don't want to get the pregnancy, you can take the pills. And number two, in case someone suspects that the family planning they are using will fail, you can take that emergency contraceptives. Or when you're having an affair with your partner and in the process the condoms may be burst and you don't want to get pregnant, you can go there and take the emergency contraceptives. But nowadays people are using contraceptives just like you intentionally go have sex and then you go there and buy the emergency contraceptives. All the mode of action of this emergency contraceptive is that they delay the ovulation from taking place. Every person understands that for every fertilization to occur, there must be a release of a mature egg. And when that mature egg gets into contact with the sperms, fertilization occurs, and from there the development of the zygote and fetus now continues to develop. You have heard of very many people saying that when you take emergency contraceptives regularly, you are subjecting yourself into infertility. I will break that reasoning and say that emergency contraceptive does not cause infertility. But because of the effects that are there, it can lead to low chances of getting pregnant because of the derangements that will come with it. First, one of the main side effects that many people have experienced is the derangement of their menstrual cycles. The two very common side effects of this drug is number one, it causes delay in menstruation, and it also causes some spotting. So when you take this emergency contraception, it discourages your entire cycle. Maybe, for example, if maybe you used to get your periods maybe in every day 15, after you take this emergency contraceptive, in a higher population of people, it discourages that. So these are the people, you take your emergency contraception, you will not get your periods the same day when you expect them to experience it, but you will see it later. Another very common side effect, it brings about spotting. Immediately you are done with taking this contraception, people start experiencing some vaginal spotting. Now, I started by saying that when you take these emergency contraception regularly, it does not necessarily lead to you not getting any child, but it brings about issues when you want to get a child in the future. This thing works this way. When you take your emergency contraception, number one, it discourages it discourages your cycle. When you now take it regularly, maybe this weekend you take this contraception, next weekend you take it again, and the other weekend you take it again, it will completely change your cycle on how you get your menses, and it will keep on postponing your ovulation. Or in other words, it will keep on making your eggs to be weak, that they cannot release this mature egg. For every menstruation to occur, first of all, there must be an ovulation. After now the release of an egg has happened, and then there is no fertilization, then the endometrium sheds off and it comes out as menses. So when there is no ovulation, automatically there will be no endometrial thickening and there will be no menses. So this is the reason why when a person takes this pill, they stay for a longer time before they experience their menstruation. Remember that we said that emergency contraception contains the hormones that are usually in the normal family planning pills, but the only difference is that the quantity of these hormones is almost double as compared to the quantity of the hormones in the normal family planning pills. Now, when you keep on taking these pills, when you take on swallowing these tablets, you are putting more of the hormones into your body to alter with your cycle. When your cycle is altered with, of course it will bring about delays in getting pregnant. But the moment you stop taking your emergency contraception, your cycle gets back to normal, your ovulation still gets back to normal, and you can get pregnant. Medically, it's not advisable for you to take emergency contraceptives more than 3 times in a year. This one means that we're supposed to take an emergency contraception at least once in 4 months. So you can now try to imagine the harm that it causes, from bringing the nausea and the vomiting. It brings about headaches. It's associated with issues with the cycles. When the issues with the cycles is not there, when there is no ovulation, and maybe before you took this emergency contraception, your ovum was already mature. It was only waiting for it to be released. Then it fails to be released. That's how people ends up getting issues with the ovarian system. And you are putting yourself into the risk of getting polycystic ovarian syndrome. The emergency contraceptives themselves does not cause infertility, but the side effect that comes with it are the ones that will subject you into getting this infertility issue. Number 1, we have said the cycle derangements. Number 2 is polycystic ovarian syndrome. And remember, in the previous video, we talked about polycystic ovarian syndrome, and we said that this is one main cause of infertility among women. So I think this video has helped you. So even as you pick your share there, as you do your things there, keep in mind that regular use of these emergency contraceptives will bring about the side effects that will subject you into infertility in future, but it does not bring about permanent infertility. Okay, so I think this video has helped you, and if this is the very first time you are coming across this channel, I kindly request you for your subscription. You can like, you can comment, and share with the friends. I say Merry Christmas to you and a prosperous New Year 2024. God bless you.